to Invest Insights. I'm Abby Maloney. I'm joined today by Mary Ann Boccolini, the President and CEO of Samaritan Healthcare. Mary Ann, thank you so much for being here today.
Thank you, Abby. I appreciate the opportunity.
Dive in. What drove you towards hospice and home care, and how do you define what that means to people who may misunderstand its intentions?
Well, my personal experience really brought me to hospice and home care because my mom died when I was a sophomore in high school. And at the time, there really was not a service like hospice that could help. And so I really understood what it was like to have that need and then be able to fulfill it later on in life. I think that the hospice benefit in particular is a benefit that people are entitled to, and it is comprehensive and it is valuable because you get a team of people. It's a huge help. And but although the awareness and therefore the utilization has increased over the years, there's still about 35% of the people who do come on our service pass away within 7 days. And the average is a little less than 2 months, and yet they're entitled to so much more. Also, the main thing that we hear if people do come on late is, we really wish we would have called you sooner. So, I think what I'd like to emphasize is that, if we are here and if anyone thinks that they might have a need, you don't really have to have it all packaged up with a bow on it. I mean, if you have questions, if you're not sure, just call and we can help you, because we do have, besides hospice, we have our primary care physician practice, we have PalMed practice. So there are other ways that people that have complex illness can be served.
What are some innovative technologies Samaritan is implementing to improve the ability to deliver care at home and further reduce costs?
Well, first, I want to emphasize that we always put patients and their families first. So that means really understanding what are the needs, and then what services are needed to then respond to them in a very appropriate, and I would say quick way. And that, when you do that, when you understand what the needs are and you have quick response to that, then that leads to better care, first of all, and a better patient experience for sure. And also then better cost efficiency, because you're responsive, you're meeting the needs, you're not dragging something out, you're not making people wait and then they need more, and there's more suffering involved. So it's really about the expertise, understanding what's needed, working with your patient and families as a partner, and responding, in a very appropriate time frame.
An aging baby boomer population, in combination with the pandemic, has placed a tremendous amount of stress upon the industry's workforce. What creative ideas or initiatives has Samaritan implemented across the organization in an effort to maintain long-term employee well-being?
Well, our culture of caring for others really has to translate to our culture of caring for our employees as well. So, we've had a wellness program for many years, so that's kind of basic. But in addition to that, and specific to COVID in the past couple of years, we have a COVID task force that meets weekly. Now weekly, it was soon, more frequent than that. We also have a special COVID support committee that then looks at what are the things that are happening right now, and that we anticipate the staff would need. So they do things like support groups. They have virtual gatherings. They created a heart-to-heart program, which is really like a buddy system.
Okay.
And then maintaining staffing levels is really key. Now, I know that that's difficult because of whatever is called the Great Resignation, or, staffing has been hard for many reasons. However, that is a key component, not only to the patient care, which is obvious, but also to support the people that are doing the service so that they're not burdened with extra work, if you will. So we continue to recruit as we always have, but we also launched a digital marketing recruitment campaign. And we have a robust search engine optimization initiative, and that helps to draw more people to Samaritan. So hopefully more people are aware. We have then once they are drawn to those pages, we do have a special careers page. So it's caring for them. It's listening. It's just as we would respond to the patients and families in a quick manner, we respond to the employees, and we're there for them. So it's all about that. There's support and the support groups and all those special things, but it's also about helping them to maintain a balance by way of the appropriate staffing.
To round out our discussion, how would you define creativity? And what does that look like for you and your business and hospice care moving forward?
Right. Well, for us, I go back to what does the patient and family need? What are those needs? And if we're working with partners like hospital systems or long-term care facilities, it's what do they need? How can we help them to support their patients? So it's really first and foremost understanding what the needs are. And when you do that, then within our realm of expertise, we can say, this is how we can help. This is, and we can create initiatives and programs, which, really the way that we have expanded our new services, that's evidence of how we listen and operate. So we started as hospice, but knew that we needed to do more for those that weren't ready for hospice or didn't qualify. So we created a PalMed program. Then we brought in home-based primary care, visiting physicians. So it's really about that, those with complex illness or serious illness, how can we best help them meet their needs and also help them stay at home and honor their goals. And then you have those programs and you have to marry that with what are the funding sources. I mean, we're not for profit. We don't turn anyone away. And we do use our donations right here in our community for those purposes. However, we don't want to start a major initiative without understanding how we could have, what reimbursement or what funding source we have, whether it's grants or, an actual, insurance company or Medicare. So it's really looking at the services and then saying, okay, how can we do this on many different levels and putting it together.
Well, end of life care is never simple. And it seems that you have really embraced creativity in all that you do. So it's very interesting to hear your perspective on how to tie all those very different challenging areas from accessing care to how care is administered, that you're considering creativity in all elements.
Yes, yes. And I meant to mention as well, under the technology aspect, and this is part of the creativity, is that we utilize a platform called Acclivity, which is predictive analytics, and that has really helped us to be able to then predict when is a patient going to, might they need a different level of care, or we get notified if, they are going to the ER, and we can help, really intervene there. So again, that creativity along with the technology has really been advantageous for those we serve.
Fabulous. Well, thank you again, Mary Ann. That was Mary Ann Boccolini, the President and CEO of Samaritan Healthcare and Hospice. If you like this video, don't forget to like and subscribe to our channel to hear more CEOs and thought leaders share their opinions and advice on the current business climate. Until next time, I'm Abby Malone for Invest Insights. Thank you for tuning in.